Scott. It's Dr. Buford here with Dr. Moore. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified about 30 or 40 times on the screen. And right now we're just trying to focus and make sure our picture is optimized. And so now we'll just start looking through the anatomy. So that instrument you see there is a shaver. And the first thing we look for here is the superior edge of the subscapularis tendon here. Pushing on it, it's fine. Hey, tell me to rotate. And just to the left of that's going to be this good-sized rotator cuff tear in the supraspinatus tendon right here. So with our shaver, we can take away some of the soft tissue from where this tendon's peeled off the bone. And this is just preparation to fix it back to the bone a little bit later on this morning. To see if there's any significant arthritis from the shaver. We're going to rotate our camera, look down, so the articular surface on the glenoid, for the most part, looks pretty good. There's a little bit of a rough area here we can smooth out pretty quickly, as you see. And then here's the posterior aspect of the joint. Things look pretty good here. Above to the left again is that rotator cuff tear. So I think we're pretty much done inside the joint. There's the anterior band of the inferior glenohumeral ligament. That looks normal. Okay, pause. Okay, Scott, so here's the tear in the tendon. If we lift up here, we can see down into the joint down this direction. To the right is anterior. To the left is posterior. So we're going to place our first anchor down right about here. We'll make a little nick in the skin. And then we're going to place our guide in for our anchor. Our guide. That's all right. Okay, so we're going to try and place our first anchor in this area right about here. So what you'll see in a minute is you'll see us tap this down into the bone. And then once we have that inserter seated, we'll unload it, and you'll see 3 pairs of sutures coming off of that inserter. And now we've got to seat the anchor by pulling back on it. Feels very solid. So now we're going to reach in from the right side of the screen. And decide what sutures we're going to work with first. I think we'll take this black and white suture first. Just like that. And now from the left side of the screen, you'll see us use our suturing instruments. Get ready to go. placing our third stitch on the first anchor. Just want to show you the progress we're making here. We're going to show you some more in a minute. Okay, we're just finishing up here. This is the third and what will be the final suture to repair the rotator cuff because it's come together nicely. Looks good. We'll finish a couple more half hitches on this blue suture and then we'll cut the tails. So what we've got is one anchor, 3 sutures here, and you can see we've got that completely repaired down to the bone. Let me see the punch, please. So we're going to go off in the video and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.